Most of us think we know what a vagina is. It's used for sex, and periods come out through it, and babies get delivered through it, and that's that. It turns out the vagina is much more important and does a lot more things than just that. So if you think of the vagina, just imagine the shape of the vagina. It's really a tube, a long tube, that's pulled up on the inside, and it's zippered to the insides of the pelvis on the left and on the right. And now that tube is now flattened out. It turns out the front part of that tube holds up the bladder, and the back part keeps the rectum in place. And at the top, there's the uterus plugged into the vagina like a cork in a bottle. And the whole setup, the vagina is actually zippered to the insides of the pelvis onto the pelvic floor muscles, if you will. So that vagina now looks like a trampoline. So what can happen with childbirth is this normally really small vaginal opening is about just under an inch sized opening, can distend to about 10 inches when the baby's head is coming down with childbirth. So that small vaginal opening can really distend quite large. It stretches the ligaments. Sometimes the ligaments can stretch or break, and the baby gets delivered, and many vaginas will go back into place. However, if the ligaments stretch or break and the zippers on the side get loosened, the vagina with activity over time can start turning inside out on itself. And that turning inside out, that falling out, if you will, is called prolapse. And it turns out, because the vagina has a front, a back, and a top, if the front is primarily falling down, there's a name for that. It's called a cystocele, because that's the part of the vagina that normally holds up the bladder. You can say the bladder is falling, and that's what the word cystocele means. If the back part of the vagina is bulging outward because of this falling down, that's the part of the vagina that keeps the rectum together. So that's called a rectocele. That means the back wall of the vagina is falling down. Usually the top of the vagina holds up the uterus if it's present, if you haven't had a hysterectomy, for example, and it sometimes keeps the small bowels out of the way. So if the top is actually falling down, that's sometimes called an enterocele. And if the uterus is present and the uterus is sliding down, that's called uterine prolapse. So there go the 4 different types of prolapse that we refer to. Cystocele if the front wall is coming down, rectocele if the back wall is coming down, enterocele if you don't have a uterus and things are sliding down from the top, or uterine prolapse if there's a uterus present. It turns out that the fix for each one of these things looks very similar. You fix the vagina. You pull it up and you pull it back into place, and you repair the defect. So there you go. There is vaginal prolapse in a nutshell. So, as we talked about earlier, the vagina is actually the device or the structure that supports the bladder, keeps the rectum in place, and helps to hold the uterus up when the ligaments are appropriately held in place. So in terms of the vagina, we say the vagina supports everything, but the vagina is itself supported. So when the vagina's support is lost or the vagina itself stretches, that's where the risk of pelvic organ prolapse, cystocele, rectocele, enterocele, uterine prolapse, that's where that kicks in when the vaginal support is lost.